Morning guys, 7:30 in the morning. We usually like to get going a bit earlier than this, but it's a Sunday, so it might be delayed. Right, this is my sad little kit that I have to lay out to sort myself out. A little spit bowl, that's what we'll speak about in a minute. A couple of syringes, big main one for feeding and whatever. Little one that I managed to get is handy if you can get hold of one of those. Pill crusher, 3 little pots for doing the pills. A couple of clean glasses, one with some water in it. A pot of pre-boiled water to sterilise it. A little strip for doing your stomach test. Food. My drugs we've got at the moment are paracetamol and cocodamol mixed. I'll mix them up. I'll explain that. My low blood pressure tablet, antibiotic, lansoprazole, the heartburn sort of thing. I've decided to start taking that. And carbastine, not a very nice one I'm afraid, but it seems to be important. And a sad little list that I'll talk about later. I think you'll find that helpful. Okay guys, start on the procedure, the morning procedure. The first thing is to get a pH reading, which you have to get out of this using these things and this little strip. You get some fluid into you from the stomach into that, drip it onto that, it should change colour. What we want to see is that pink at the end or orange, what you see on there, turn bright yellow. Okay, now this will invariably fail, but we'll give it a go. That's what I tell you to do. I use this nice little one that I managed to blag out of the hospital. If I were you, I'd try and get one. The big one works, but I think it's got too much suction, and this little pipe there has to pull it out. I think it just sucks it in and blocks it. But anyway, you'll see. That's the sort of it. As I'm doing that myself now, can you see that it's bouncing back? It's obviously not getting anything. So I'll just loosen it off. Let it suck some air in, and then little backwards and forwards like that. Quite often, first thing in the morning, I will get a silly little bit out, which won't give me a proper reading for some reason. I don't know if it's what's been left in the pipe overnight or what, but I usually ignore it and tip it away. So I'll go on to the second bit now. If you can't get a reading, don't panic, you will get one eventually. They tell you to lie down on one side or the other side, just try and do that. Fortunately, they started letting me have little sips of water as part of my exercise for this valve. So my exercises, I'll show you, but it's sip a little bit of water, hold it in your mouth, hold your breath, swallow it 2 or 3 times. You'll feel it go down. So if it makes you cough, don't worry about it, that's what it's supposed to do, a little bit of cough up. But if you get told to do that, but I've got to a stage now where I can actually drink water. But I'll just show you the little sipping exercise. I don't know if you can see, I'll swallow that sort of 4 times, but just to make sure it goes down, don't worry about it. And I can actually sort of drink about, I don't drink any much more than this, because the danger is it's going into your lungs, which can cause them, it's caused me problems and breathing problems, so not very nice. Be careful with that. So you can see I'm drunk on that. I'll just switch off for a second now because we have to wait for that to just a few minutes, wait for that to go down. I'll time it, let you know. Well, there we go, a couple of minutes later. Get this thing out. As you can see, it's got like a wire piece on it. They tell you to use a straight one rather than that one. They know that one's there, but anyway, I suppose it's a straight one, it goes straight into your stomach, way out your stomach, but that's the one I'll use. So, same thing again. You might do a bit of work on it. And I'd say, just screw this in and out a couple of times as you're doing it, you'll find it to help. And sometimes I'll push some air in on purpose like that. Keep going. You sort of get a feel for it after a while. When you're doing this, don't panic. It will eventually come out. You end up thinking, oh, this pipe goes right up your nose, down your ear, right down to the top of your chest. And that's how it's got to stay in position. You've got to stay in position to sort of frighten you a little bit. Because when it don't work like this and you start to panic, you end up thinking, oh, it's gone out of position. I ended up going up there having an eye x-ray on it and Oh no, it's still there. Of course, time you get there, it's working fine. In a way, it's good that it's not working like this, because you can see that even a whole hand like me